Welcome back to Medicine Deconstructed. I'm your host, Dr. Jay Rutland. As you all know, my wife had breast cancer as well as my aunt. I have 2 daughters and an aging mother, and as a physician, I'm invested in women's health. So today, we're here to talk about cervical cancer, and we're going to talk with my PA students this week, Adriana and Sahar.
Hello, I'm Adriana and I'm a second-year PA student at Point Loma Nazarene.
Hi, I'm Sahar and I'm a second-year PA student at Chapman University. The cervix is the lower narrow end of the uterus that connects to the vagina. It allows menstrual fluid to pass from the uterus into the vagina and also widens during childbirth.
During a Pap test, a provider will use a small brush and gently collect cells from the cervix. These cells are sent to the lab where they will be examined for the presence of HPV and cervical cancer. Your provider will also perform a physical exam looking for signs of cervical erosion, an ulcer, or a mass in the transitional zone of the cervix. That's it.
Pap tests and screenings for HPV and cervical cancer should begin as soon as patients are sexually active at age 21 or experience abnormal vaginal bleeding, such as bleeding after sex, long periods, or bleeding between periods. Other symptoms to look out for include abnormal vaginal discharge, low back pain, and urinary symptoms.
Did you know there's a vaccine that can actually prevent cervical cancer?
I do. An actual vaccine for cancer is pretty amazing. But first, I'm going to have Dr. Rutland go over the science.
Excuse me. It turns out a virus called human papillomavirus, or HPV, is the main cause of cervical cancer. HPV is a double-stranded, non-enveloped DNA virus that is considered a sexually transmitted infection. There are 225 types of HPV, but HPV 16 and 18 account for 70% of all cervical cancers in the United States. About 80% of women will get at least one type of HPV at some point in their lifetime, and HPV is linked to 99.7% of all cervical cancer cases. What happens is when human papillomavirus is in the area of the cervix, it's going to end up infecting the cervical cells. The way it binds is through 2 structural proteins called L1 and L2. L1 binds to the extracellular matrix and heparan sulfate proteoglycans located near cell membranes, and this facilitates the virus's entry. The virus's presence also leads to production of proteins E6 and E7, which end up inhibiting the negative regulators of the cell cycle like P53. This is what leads to cancer, transforming healthy cells into malignant cells, causing an uncontrolled replication of those cells. Otherwise, cancer.
So that's why preventing HPV is the key to preventing cervical cancer.
Exactly. Vaccination with Gardasil, the HPV vaccine, is recommended for women, men, and children aged 9 to 26 to prevent infection with HPV type 16 and 18.
This topic is actually deeply personal to me. My grandmother actually passed away from cervical cancer, unfortunately. So if I had known these guidelines earlier, I might have been able to help her, and she could still be with us today.
I'm so sorry to hear about your grandmother, Adriana, but unfortunately, your family story is not uncommon. Cervical cancer is the 4th most common female cancer worldwide and one of the most preventable cancers today.
Unfortunately, my grandmother didn't have access to the Gardasil vaccine, and she never had a Pap test. Did you know in the United States, approximately 13,170 cases of invasive cervical cancer are diagnosed each year, killing about 4,250 people annually? And sadly, 85% of these patients were just like my grandmother. They never had a Pap smear, which could have saved their lives.
Thank you, Adriana and Sahar. Understanding cervical cancer is vital for prevention and early detection. Regular screening and vaccination can save lives. Knowing all of this can help ensure that fewer families have to suffer the loss of a loved one to this disease. Thank you all for listening, and we'll see you next time here on Medicine Deconstructed.